Kubor nakaslem jong udongsan Hima.
Honorable Deputy Speaker, sir, I wish to thank you for allowing me to take part in the short duration discussion on the most important issue concerning the pregnant mothers and infant babies of our state, which was carried out in the English daily, the Highland Post, dated 29th August 2020, with a caption, "State records over 877 deaths of infants and pregnant women in April to July." Honorable Deputy Speaker, sir, I am greatly shocked to learn that during the pandemic period, that is April to July 2020, there has been a sharp increase in the death of pregnant mothers and infants. This shocking revelation made by the Director of the Health Services that 61 pregnant women and 877 newborns have died in Meghalaya in the 4 months starting from April 20 due to lack of medical attention, for want of admission to hospitals, fear of being admitted to hospitals, and mainly because of the diversion of the health machinery to fight COVID-19 pandemic. So this goes to prove that the maternal mortality rate and the infant mortality rate in Meghalaya is increasing day by day without any efforts made by the government to intervene. Interestingly, the Commissioner and Secretary Health rather contested the statement that the data of the Director of Health Services on the strikingly high rate of infant and the maternal mortality by saying that the main cause of the mortality rate is related to socio-cultural issues, which caused a lot of resentment amongst the medical fraternity. He also stated that being a matrilineal society, women in Meghalaya face barriers in terms of making the right choices insofar as reproductive rights are concerned. But, Mr. Deputy Speaker, sir, the reality on the ground is that pregnant women and infants are still victims of poor medical attention, lack of institutional delivery, and poor postnatal care of mothers and their babies. It is sad to note that though we are in the 21st century, health care for pregnant mothers and the babies in our state is still a matter of serious concern. It may be also noted that due to the corona pandemic, many government programs like immunization, regular prenatal and postnatal examination scams have taken a backseat. Sir, recently during the Garo Hills tour of the Women Empowerment Committee, where I am also a member, it was reported that there are so many deficiencies in the hospitals all over the Garo Hills. In the southwest Garo Hills, the number of reported cases of infant mortality is 89 between the months of April to September 2020, and that of the pregnant mother is 4. So the committee, during its tour to the southwest Khasi Hills in Maukarwat, was informed that between the months of April to August, there has been 48 cases of infant deaths and 5 cases of maternal deaths. So examples of these 2 districts are sufficient to confirm to the total figure of 877 infant deaths and 61 maternal deaths in just 4 months all over the state. Honorable Deputy Speaker, sir, the government need to immediately stop these deaths and address this sensitive issue at any cost. We cannot afford to be just mere spectators of such tragedies happening in front of our eyes. According to the DHS, most of the women died because they were not admitted to hospitals or health centers for institutional delivery. The newborn deaths were due to the lack of medical attention, pneumonia, birth asphyxia, and prenatal and postnatal care. Sir, the state has an infant mortality rate of 34 deaths per 1,000 live births, and pneumonia is the major cause of death of the babies at birth. Interestingly, Southwest Garo Hills has more cases of babies dying due to hypothermia. Therefore, while looking at the healthcare scenario in the state, there is a complete failure of the health department to provide even reasonable healthcare services to the people. A premier hospital like the Ganesh Das Hospital in the state capital also lacks infrastructures, equipments, then the intensive care units for babies, shortage of beds. Recently, during the pandemic, a pregnant woman was denied admission due to shortage of beds, resulting in the death of the baby. Many MCH hospitals constructed all over the state under the NHM are still not functional due to the lack of doctors, nurses, and equipment. These buildings are already leaking and all the glass panes are broken. It is really sad to see the way the health department is handling this matter. One mother and child health care unit has been constructed in Mausangram since 2017. And till date, this unit has not functioned due to the non-sanctioning of the power transformer by the Department of MECL, which is merely 5 lakhs. So, the sub-centers for healthcare are all in bad shape. The buildings are old, dilapidated, and most of them are no longer fit for occupation. Most of them are located far away from the road and habitation. The PHCs and the CHCs too are getting congested. They need repairs, and most of them do not have regular water supply and power connections. So there is a shortage of doctors, nurses, and technicians in all the government hospitals. In Southwest Khasi Hills, there is no gynecologist, no pediatrician for the whole district. There is no blood bank in the whole district. How will the pregnant mothers and newborn babies be taken care of? Most of the people living along the Bangladesh border are dependent on the medical care from Bangladesh doctors. It is a matter of shame for us if our people have lost their faith in our medical care system and have to cross the border to Bangladesh for treatment. Whom should we put the blame upon? There are no ambulances in many rural hospitals of the state. In the Ampati Civil Hospital, there is no pediatrician, no gynecologist, no anesthetist. One digital X-ray machine has been supplied to this hospital in Ampati. But a technician to fit the machine has failed to come till date. A TrueNat machine is yet to be set up, although supplied 1 month back. It is still unwrapped from its package. There is no ambulance for COVID-19 in Ampati. Most of the hospitals in the state have been supplied with radiant warmers for the newborn babies. But they are all out of order for months together. Sir, the Pradhan Mantri Matri Vandana Yojana, PMMVY, is a conditional cash transfer scheme for pregnant and lactating mothers of 19 years and above for the first live birth. So, many women throughout the state are ignorant about the scheme. There is no awareness about the cash incentive under the scheme. The health department is required to assist these women in opening the bank accounts in the banks with less formalities. So under the MHIS, many rural women are still without a health card. The enrollment process under MHIS should be more vigorous to facilitate the people to get the benefit under the health insurance scheme. So the other matter of concern in our society that affects the health of our young women is the teenage pregnancy. Between the month of June and September, there has been 56 cases of teenage pregnancy in Southwest Khasi Hills alone. There is a similar rise in all the other 10 districts too. Government is required to check the teenage pregnancy for the future benefit of our women in terms of their health. Therefore, in view of my submission, I strongly feel that the health department has to work harder to improve the healthcare system, particularly for the pregnant mothers and the infants of the state. The government has to save the lives of these mothers and the babies. We would not like to see any more mother or babies dying. So I appeal to the Honorable Chief Minister to bring about immediate interventions in order to achieve better ratings in the MMR and IMR. And also, I will appreciate if the Chief Minister personally reviews and monitor the functioning of the Health Department. With these few words, I resume my seat. Thank you very much, Mr. Deputy Speaker, sir.
May I ask whether all honorable members who sign in the short duration notice would like to participate? Yes. Okay, then I will allow Dr. Amprin to participate first.
Honorable Deputy Speaker, sir, at the outset, I would like to express my sincerest gratitude to Ba H.M. Shanklia for having tabled this very important call attention on this very pertinent issue of the current status of the MMR and IMR rates in the state of Meghalaya, sir. Over and above all of the important submissions made by my colleague, by Hima Shankliang, I would also like to briefly submit some observations with a hope that this important agenda is attended to by the government of Meghalaya. Sir, we must place on record the efforts being put in by the various staff of the DHS all the way down to the blocks. We have to appreciate the efforts that they put in to ensure that health is addressed, the health issues are addressed in the entire length and breadth of our state. In fact, through the privilege of a House committee given to us to be members of, we have been able, sir, to collect information and data from various parts of the state, and we as a committee would definitely ensure that all of this information is firstly thrashed at the district levels, and then we take up all of these informations that we find to the attention of the DHS. So what we need to immediately do in the entire state is to ensure, number one, that your sub-centers should start functioning. Up till today, the state of Meghalaya is still very poor, sir, in its institutional delivery. We cannot rule out the fact that there are so many myths and so many beliefs, traditions, customs that also circulate reasons for individuals preferring to deliver at home. And instead of hammering the institution that is supposed to be delivering in the correct manner, I think it would be in the fitness of things if we request the Department of Health as a whole to try and find out a way to break these social customs and traditions which are prevalent in a big way in so many distant districts across the state. I cannot imagine, sir, that traditional healers are considered more relevant than medical practitioners. We have to find a consolidated way of addressing these customs, practices, and beliefs. I cannot imagine that in this day and age, there are still mothers who say that we will not buy clothes for our children till they are 1 week old because it is bad luck. We have to find a way to break this myth, and we have to find a way to insist that in the 21st century, all mothers must be made responsible, that their children not only are born in the best of services, but are also reared and been given a chance to live their lives. So the other thing that was mentioned in the submissions of my colleague, H.M. Shankya, was the fact that even in this day and age, diarrhea is still a big cause of the rise of infant mortality rates. We need to find a way out. I am told that through the various Government of India schemes like the Jana Ni Suraksha Yojana for safe motherhood intervention under the NRHM, the JSSK for postnatal care for children and women. These are the kinds of schemes which, if properly intervened through your ashas and other health workers in the system, social customs and beliefs will and should be addressed. Looking at all of the numbers that we had experienced and were exposed to in all of our trips across the state, sir, we have come across a very unique system in the state of Meghalaya. I don't know whether it is also popular in other states, but you have, through these various schemes, the traditional person who gets trained to actually become expert in the matters of childbirth. So we have to see that since there is this resistance from the public, especially during the pandemic, to approach an institution like a sub-center or a CHC or a PHC these individuals should be trained properly. We have been made to understand that our nurses are also important individuals that actually assist to a great extent for the process of childbirth. I think we must, over and above training properly the skilled birth attendants, also train these nurses who remain the only link to institutional delivery in most distant places in the state of Meghalaya. Sir, I am also very concerned about the rise of teenage pregnancies in the district of Ampati. If I may be permitted to correct my colleague by H.M. Sangplyang, the 56 cases of teenage pregnancies was in the district of Ampati. But sir, this is also a phenomenon that is there in every part and in all districts of the government of Meghalaya. In fact, we have requested the various SPs that we met across in all of our tours to have some sort of a consultative program with the Department of Health officials so that they can coordinately have a proper redressal mechanism to curb teenage pregnancies that is very rampantly found across the state of Meghalaya. So one factor which needs to be addressed immediately is this unavailability of drinking water facilities in so many institutions that we went to. It is very important that our villages, especially institutions of health, in all of our districts, blocks, are connected with portable drinking water supply. I have seen that there are many Government of India schemes that are now at the disposal of the Government of Meghalaya for this intervention, and I look forward to an improvement of the statuses of potable drinking water reaching especially the health institutions, no matter how small or no matter how big. I cannot imagine that the Ampati Civil Hospital actually is still up to date, not connected with water, drinking water supply. So these are all indicators that maybe some factor should be assigned to all of these challenges that are there in all of our institutions so that we overall improve the MMR and IMR ratings in the state of Meghalaya. I request the Honorable Chief Minister particularly to have an immediate review of all of these schemes of the Government of India. Some sort of an auditing should be there so that through these different facilities that are inherent components of the implementation of the JSY, the JSSK, and the other schemes, they themselves will be instruments to help the citizens of the state of Meghalaya provide not only for their pregnant mothers, but especially for infants who all deserve an opportunity to a fair chance of life. And with these few submissions, sir, I thank you for having given me this opportunity to participate in this short duration discussion under Rule 50 of the Rules of Procedure and Conduct of Business of the Legislative Assembly. And I hope that all of my suggestions would find a place in all of the notes being taken on by all of the various officials who are here. And though this is a very difficult task, I'm sure we can together try and find ways and means to put this behind us and give every life in the state of Meghalaya an opportunity to the best health facility. Thank you, sir.
Just in the recent few months, there was a case in Ganesh Das Hospital where the pregnant mother was turned away. Maybe these are reported cases. What about many other cases where pregnant mothers, when they reach the hospital, due to lack of capacity, they have to be turned away? I would request the government, sir, that perhaps a helpline should be set up in the lines of 108, or maybe the 108 itself should be given the responsibility that a dedicated helpline for pregnant mothers, so that they can call this helpline, and in case they need any assistance for accommodation in any hospital, the helpline is there, the help desk is there to assist them to the nearest hospital where they can get support and medical help. This will reduce the constraint on our citizens, especially at that moment when they have to run helter-skelter to find assistance for the pregnant mother in the need of the hour. So therefore, sir, perhaps a helpline would be the best to ensure that our pregnant mothers, they can call, their family members can call to assist and to get the nearest, to get to the nearest hospital for accommodation. Sir, our Ashas, as an honourable member from Nongpo has already submitted, where their dedication, their support, their help, their assistance to all the citizens is much appreciated, and they are the frontline workers for us, especially when it comes to mothers and children. But sir, there are still many other villages where the Asha services need to be extended. Hundreds of villages across the state where the Asha services need to be extended. Therefore, sir, we need to expedite in order to cut down on the maternal and infant deaths that are being reported across the state. With Ashas and their help and assistance, we have seen a lot of progress. And therefore, sir, this assistance needs to be extended, and Ashas also need to be deployed further. One case in point, sir, we're just returning from the interstate border just on Saturday. There's a plea from the interstate villages where, especially the Block 2 areas, where the Asha services are not available. We have intervened at the district level at Nongpo. Now the Malosnai PHC has been able to cater to the needs of the residents in the interstate border in Block 2. It is much appreciated, but we also need to extend the Asha services as well. Sir, coming to nutrition, just in the other session, I had asked a question from the Social Welfare Department as to how many children are still yet to be covered under ICDS. At that point in time, sir, it was 10,000 plus. 10,000 children are still not being extended with nutrition services under social welfare ICDS program. Sir, this is just an official record for the government. The number might be more. And it is increasing by the day because there are childbirths happening. There are children that are growing every day, especially under 3 years of age. With malnutrition, sir, child deaths will increase. The disease, they are much more prone to disease. They are much more prone to weaker immune systems. But then when we ask the government, what is the status of putting in more ICDS centers, they said that they have written to New Delhi twice. Now it's been another 8 months, sir. This has been dragging on. No news again. Maybe they'll keep on writing like this. So this sending of letters and missives, this entire system, sir, we are witnessing, because of the failure of the system, we are witnessing our children being, going through different kinds of disease and challenges because of malnutrition. So these are few submissions which will help to facilitate a better healthcare system, better nutrition, so that our children are much more stronger, our mothers get access to good medicine and food. And we hope that the government will look into these issues and perhaps come out with stronger policies, improved policies and delivery systems that can improve the mortality and child mortality, mother mortality in the entire state, sir. With these few submissions, sir, I resume my seat. Thank you.
Mr. Speaker, Mr. Deputy Speaker, sir, I would at the very outset like to thank the honorable members, especially the honorable member for Mausangram, Shri H.M. Champliang, who has raised a short duration discussion under Rule 50 of the Rules of Procedure and Conduct of Business regarding the news item which appeared in the Highland Post dated 29th August 2020 under the caption, quote, "State records over 900 deaths of infants and pregnant women in April to July," unquote. Sir, I would also like to take this opportunity to thank the honorable members, namely Srimati Amperin Lingto, honorable member from Limukra, Shri Merrill Bon, honorable member from Nongpo, Shri P.T. Sokme, honorable member from Maulai, Shri George Lindo, honorable MLA from Umroi constituency. I hope I've covered all. Thank you to all the members who have participated and given their suggestions on this very, very important discussion, I should say. Sir, at the very outset, I would like to state that this is a very important issue. There is no doubt about it. It's a very, very important and an issue that needs to be addressed from all aspects, as has been mentioned by the honorable members. So the issue of infant mortality and maternal mortality is something that is not just a health issue. We have to realize that this is a problem that has many aspects linked to it. Health is one part of it. There is a social aspect to this entire thing. There is an economic aspect. And in fact, in general, there is an aspect of empowerment of women overall, which has to be seen into this. And I will elaborate more on this as I go along, but I would like to stress that this is a very important issue. So let me just go through some numbers just to give an idea to people what we are looking at. So the maternal deaths in 2015 was 211. In the year 2016-17 was 198. In 2017-18, this is of course MMR, sir. 2017 it was 197. In 2018 it was 164. And in 2019 it was 174. And as we speak, the latest numbers that I have stand at 61. Similarly, when it comes to infant deaths, which is 0 to 12 months, 2015 was 2,513. 2016 was 2,427. 2017 was 2,512. 2018 was 2,074. 2019 was 2,524. And as of now, the current data that I have, at least from April to July, is 889. So what I'm trying to get at and trying to make the House understand is that this has been a trend in our state which is very, very sad and should not have happened. We have consistently seen that we have had approximately 190 deaths in maternal deaths and consistently seen 2,500 deaths in children. This has been consistent for the past 5 years. Just to give an idea to everybody that we are looking at a trend. That's my first point, sir. So second point which I would like to make is that when you see this caption that appeared in the Highland Post, state records over 900 deaths of infants and pregnant women in April and July. Sir, I'm not trying to undermine the importance of this issue. It's a very important issue. But I would like to just gave the perspective of what the health department was also trying to communicate to the people, which is that we are sitting here and we talk about COVID every day, and we have meetings every day on COVID, which is a very, very important aspect. And the fact that close to 100 people have lost their lives in COVID, what the DHS was also trying to communicate to the people was that whereas we are so concerned about COVID, which we should be, there are also 900 mothers and children who are dying. So is our attention too much on COVID, and are we looking at COVID in a different manner and not realizing that there are many other reasons for deaths that are there, and that children and mother are also dying? And I think this comparison is what the DHS, I think when he gave this particular statement, he was also trying to bring this perspective into the picture, that there are many other issues also that we should be worried. And today, as we go along, we are seeing that we are, as a society, accepting what COVID is. We are moving forward with the challenges that we face, keeping our safety measures in mind, keeping our social distancing, mask wearing, hand hygiene in mind, and realizing that we have to move on. And though COVID was a new virus at that point in time, we were very scared. But there were other reasons why people were losing more lives. And therefore, it was just, I guess, a message to really compare in a way that we need to think about all the aspects of health in the states. So just wanted to give the perspective from that point of view. So coming to mother and maternal deaths and the infant mortality deaths. So in the year 2019, as a government, of course, we had been looking at all the data for a very, very long time. But then we came out with an actual program. And we called it the Measurable Outcomes in Transforming Health Sector through a Holistic Approach with Focus on Women's Empowerment. And we called it the Mother Program. And Mother is, of course, an acronym, but it also is very appropriate because it deals with mothers. And Mr. Chairman, sir, with that program in mind, we started looking at the institutional deliveries in one particular district. What we started doing was we started using technology to monitor all the pregnant mothers. So in southwest Garo Hills in Ampatti, we started this program where at that point in time, we had an institutional delivery of approximately 50%, could be plus minus. We started with that. And then we started mapping every single mother. We started mapping on when is she going to expect to deliver. We started mapping who are the high-risk mothers. We went down to micro details of mapping who is the doctor who is giving her medical attention, who is the ASHA worker, who are the other medical officers who are taking care of her, who is the closest ambulance driver to her, her husband's number, her parents' numbers. All this information was tracked. And after that, we even went to the extent of going and seeing which are the auto drivers who happen to be within 2-3 kilometers of vicinity in case the ambulance cannot come in. And this mother app kept a track of those auto drivers also. So this program called the Mother App program was done specifically to ensure that we are able to track every mother. We know exactly who are the high-risk ones, and a continuous monitoring from the ASHAs, from the medical officers, doctors, from the nurses was being done, and these mothers were being tracked, and they were being encouraged to come to institutions for delivery. And at the same time, we were able to look at the high-risk ones, which ensured that we made sure that we gave special attention to these mothers who were of high risk. And I'm happy to inform you that within 6 to approximately 8 months, we were able to touch 80% in terms of institutional delivery in Southwest Garo Hills. This is the mother program that we had, and it was a pilot project, and it showed the results. And after seeing the success of this program, we then opened it up to the whole state. So last few months, we have been now encouraging the health department and the deputy commissioners and the district medical health officers to ensure that they register every single mother who is pregnant and expecting. We are trying to also ensure that we get all the data, including the high-risk mothers who are there, because those are the ones who have a higher chance of losing their lives while delivering. So the high-risk mothers are very important, and now we have started expanding it throughout the state. And I'm sure that as we move along, as we start monitoring the mothers, I'm sure we will be able to bring down the maternal mortality rate to a large extent. Let me tell you, sir, the benefit of this, small benefit at least when it comes to me and the Honorable Health Minister, that now we don't have review meetings to check on the data that is coming in. This data and this mother app report is available on my mobile phone. I can at any given time tell you how many pregnant mothers are there, how many are expecting to deliver next week. Of course, these are things that we cannot be 100% sure because it depends on every individual. But roughly we have an idea of who is going to deliver and who are the high-risk mothers on my fingertips. And I can actually get a printout of the data for every district, and I simply send an email to their DCs asking them what is the status of this. I don't have a review to see the numbers. I see the numbers and I ask the questions to the district medical health officers and the deputy commissioners. So this is how technology today is helping us to gather the relevant information. Secondly, sir, when it comes to this mother app, as I was mentioning in my opening remarks, that health and the health of the mother and the child is not just a health issue. It is a socio-economic and health issue, three things together. And realizing this, now let me tell you why this is also important, sir. When it comes to the deaths in the mother, the maternal mortality, now we have been reviewing this every week. I want to repeat, every week these numbers are reviewed. Sometimes I am there, but in case I am not there, the Commissioner Secretary reviews this every week. And we've seen a trend. We saw a trend that showed that over 10% of the deliveries are teenage pregnancies. 10%. Over 30% are deliveries which are more than the third delivery, below the age of 30. That means before a woman turns 30, she's already got her third child. We also came to understand that 40% of the deliveries or pregnancies, I should say, are unintended and unwarranted pregnancies. So we can clearly see that these trends are emerging, and we're realizing the importance of taking certain measures in certain areas, which will help the mothers and decrease this. So therefore, realizing all these aspects, we felt strongly that we must connect the nutrition program, we must connect the mother's health program, and we must connect the economic empowerment program through CNRD or through self-help groups together to be able to see an actual difference in the long run, not just a short-run difference of just seeing few numbers come down. It is a long, drawn affair. There has to be interventions at different levels. Another reason why we're saying this is because there is no spacing between the births of children. And if you look at the entire process, that a lot of these deaths that occur is because of multi-gravida, and lack of spacing between the children that are born is actually missing. And women have actually no right, in the sense that there is no defined policy and no discussion in society to talk about the spacing between two children. And medical professionals will tell you that it is most probably one of the most important aspects. So we need to look at all of these aspects. And therefore, as I said, we combine social welfare, which is nutrition, we combine health, and we combine rural development, including self-help group movement, in one platform, and this is what we're calling the Mother Program. And so we will see that as we move along in this project, that we will look at the mother's health, not just when she's giving delivery, but as soon as she gets pregnant. Not just when she gets pregnant, but even before that, to plan out the spacing of the pregnancy. And we realize that this can only be done if we make the women in the rural areas more economically engaged in different activities. If we are able to provide in a very safe manner different kind of birth control. So these are the issues that we're dealing with. So when we look at just the number of deaths that's taking place in maternal death, I think we're looking at the last point, which is really not fair. We need to see the entire spectrum of activities and interventions need to be made at every step along the way. And that, Mr. Deputy Speaker, sir, is the only way to address this issue in the long run. And this Mother app is what is going to allow us to do that.